Immunotherapy for mesothelioma metastasis, benefits and risks. Immunotherapy is an innovative treatment approach being explored for mesothelioma that has spread, or metastasized, beyond the mesothelium lining of the chest cavity. This type of cancer, known as malignant mesothelioma, can be difficult to treat once it has metastasized. Immunotherapy aims to harness the power of a patient's own immune system to fight cancer. While promising, immunotherapy also carries some risks that are important to understand. Here is a more in-depth look at the potential benefits and risks of immunotherapy for treating metastatic mesothelioma. How immunotherapy works against cancer. The human immune system has natural defenses that are normally able to recognize and destroy cancer cells. However, some cancer cells, like mesothelioma, are able to evade these defenses and grow unchecked. Immunotherapy attempts to re-engage the immune system and enable it to better target cancer cells. There are a few main approaches in immunotherapy. Checkpoint inhibitors take the brakes off immune cells called T cells that would normally attack the cancer. By blocking certain checkpoint proteins, like PD-1 or PDL1, the T cells are free to activate and start destroying tumor cells throughout the body. Adoptive cell transfer involves collecting a patient's own immune cells, such as T cells, expanding them in the laboratory, and giving them back better able to find and kill cancer anywhere in the body. Engineered T cells can also be modified with special receptors to boost their effect. Cytokines and other immunostimulants work to generally enhance the activity of immune cells like T cells, NK cells, and macrophages, helping them overcome tumor defenses and clear metastases. Benefits of immunotherapy for metastatic mesothelioma. Some potential benefits of immunotherapy for metastatic mesothelioma include longer survival. Several recent clinical trials of checkpoint inhibitors have shown they can significantly extend overall survival in mesothelioma patients compared to chemotherapy alone. Median survival times have improved by months in heavily pre-treated groups. Systemic anti-tumor activity. Immunotherapies work throughout the body and have the ability to shrink metastases at distant organ sites, not just where the primary tumor was located. This gives them an advantage over local therapies. More durable responses. When immunotherapy is effective, it can often keep cancer in remission for years instead of just months. Immune cells develop a memory that prevents regrowth. Combination with other treatments. Immunotherapy is being studied together with chemotherapy, targeted drugs, and radiation to make responses even stronger. Combined with vaccines or other immunostimulants, more patients may achieve benefit. Potential for minimal side effects. While immune therapies can cause their own side effects, they are usually milder than chemotherapy and not as toxic to healthy cells. If tolerated, patients may avoid harsher treatment effects. Risks of immunotherapy for metastatic mesothelioma. At the same time, some risks and limitations of mesothelioma immunotherapy to be aware of include immune-related side effects. By disrupting the body's natural checkpoints, immunotherapy drugs can overstimulate immune responses that then attack normal tissues and lead to side effects like rashes, colitis, hepatitis, pneumonitis, thyroid issues and more. These autoimmune reactions generally respond to treatment, but interruption of therapy may be needed. Limited response rates so far. While immunotherapy has improved outcomes in mesothelioma, complete remission is still rare. Current response rates from checkpoint inhibitors are around 15 to 20%. Multiple lines of therapy may be needed. Not a cure. Immunotherapy alone is usually not sufficient to cure metastatic disease. Responses may last less than a year on average and can stop working. Adjuvant therapies are still necessary after immunotherapy. Individual variability. Only a subset of patients seem to truly benefit from immunotherapy. It is difficult to predict who will respond based on biomarkers or other factors. More research is needed to tailor treatments. High costs. Emerging immunotherapies are often costly, running over $100,000 per year of treatment. Access can be limited by insurance coverage in some healthcare systems. Immunotherapy brings new hope for overcoming mesothelioma that has metastasized by capitalizing on the power of a patient's immune system. While responses have been promising, challenges remain in improving outcomes further, reducing side effects, and addressing issues of cost and availability. Careful consideration of both pros and cons is important when weighing this approach. Continued clinical study remains crucial to realize immunotherapy's full potential against metastatic